this profession called public health because it cut across the profession and the domain. I mean, you're not limited to, unfortunately, we understand health with medicine, which are actually totally different. Health is actually something which relates to medicine, but not altogether. So health is something which has to do with sociology also. It is connected with your economics as well. It is connected, of course, with medicine, but this also gives you an advantage if you have some training in medicine. But if you have a training in sociology or psychology or basic science, even physics, chemistry, that it also gives you an advantage to understand logically or rationally to get into public health. Industry really doesn't differentiate between your background when you've done your master of public health. What they look is your deepness and your understanding about the subject of public health per se. I mean, if you come with a healthcare background, it could be an advantage, yes, sure. But if you come with economics background or a sociology background, it will give you additional advantage because it's all about understanding the diseases and making your interpretation and how it could help the society or how it could help formulating those policies or implementing those policies. So it's not only about just understanding the healthcare. All professions which are either sociology or history or geography or something are more than welcome to take up this, and industry is very much welcoming. This actually gives a diversity in the workspace in terms of public health. Maybe, Nandita, if you'd like to add something on that.
I think Professor Marks had sort of also, Nitish wonderfully said it's a very applied field. But Professor Marks had also, when he started, his talk, like the introduction to public health. So one of the things we learn very, very early on as we start the MPH is that health providers are really looking at an individual perspective. They are looking at the individual, they are looking at a disease and so on. But I think when you come into public health, you're looking at health from a population perspective. You're thinking about broad trends. You're thinking about, you're sort of problem solving all the time. And you're really driving some of the narrative in terms of health policy. So I think that is the real distinction. I don't think having, it's a very applied field. And as Nitish said very rightly, different sort of areas of expertise give you different sets of advantages in the field. So certainly coming into this field, I don't think that should be a barrier that, I'm a doctor. Does a doctor have an additional advantage? Not really. I think it really depends on what you want to do, what you have specialized in, and what you're looking at. So I would just say that COVID has really taught us that it's not just about curing, but it's really about managing systems. It's really about thinking about, delivery of vaccines. And those are not just skills that doctors can do. You need a whole range of healthcare professionals who are really driving the system.